First of all, welcome everyone to our second event here in Denver, Colorado, welcoming the Honorable Secretary, first ever Latino Secretary to serve as the HHS, or Health and Human Services Secretary in the Biden-Harris administration, back to Colorado as a part of his Latino tour. And we are so honored to join the Honorable, also, United States Representative, Congresswoman Yadira Caraveo. So thank you so much. My name is Lily Griego. We are so honored to have everyone here today. We do have a nice agenda, but it's gonna feel like it goes like that. So without further ado, I'll get into why are we here. The Secretary is traveling the country celebrating some of the accomplishments of the administration. We have much to celebrate, and yet we have lots of work to continue to do. So we are here to have a conversation about creating access and our accomplishments in access to health care and health insurance, and still hearing from local community members about what folks are experiencing on the ground in terms of challenges and successes. And then we also want to share our journey with the Congresswoman and talk about the work that she's been achieving in Congress on behalf of the American people, most importantly, Congressional District number 8 for Colorado, as a result of the 2020 census. I always bring that up because who knew that I would talk with you about the 2020 census and be sitting here with you a handful of years later?
It was certainly not my plan.
I love it. I love our story. So if you all don't know that, I led the census here in Colorado, which I never knew, and had the honor of speaking with you about why the census mattered a handful of years ago. My name is Lily Griego. I have the distinct honor to lead HHS here in Region 8. I am under the leadership of Secretary Xavier Becerra, and we cover Colorado, Utah, Wyoming, Montana, North Dakota, South Dakota, and 30 tribal nations. And I share that with everyone because our region is highly rural and can testify to lots of challenges here in seeking access to health care and lower prescription drug costs. So we're going to kick off our conversation, and I'm going to turn it over to Congresswoman Caraveo with an opening statement.
Well, I'll make it very brief because I really want to hear from you all. I mean, unlike most Congress people, since there's only 4 Democratic doctors in Congress right now, have the experience of having seen patients much like the ones that you see here at Kids First. And really what drove me into politics was the kind of conversations that we have every day around prescription drugs, around how difficult it is to get insurance to cover them, how big of an impediment it is to take care of the health of children and adults in our community, and how we need that experience really transmitted to Congress so that we put the patient and the healthcare provider back at the center of healthcare. And so it's wonderful to have an administration that understands this need, that is willing to take on pharmaceutical companies and insurance companies to say what you're doing is wrong, we need to take care of people, and that doesn't include you jacking up the price so that it's inaccessible. And so it's really wonderful to have the Secretary back in Colorado on a beautiful spring day to hear from you all and about the experiences that you have taking care of patients or being a patient, and how the affordability aspect of it really impacts health.
Thank you so much. Secretary?
I'll just first begin by thanking Congresswoman Caraveo for inviting me. Dr. Caraveo understands health as well as anyone in Congress, and it is great to have an opportunity to team up with her and be here in her congressional district at her invitation. I'll keep coming, you keep inviting. But more importantly, I think it's important for me to be in a place like this because from our perspective, at least personally as a secretary, my perspective, being in a community health center is the place to be if you're serious about trying to address the gaps that we have in our healthcare system, our public healthcare system. And so I'm thrilled to be here. We will do everything we can to continue to elevate the community health centers. We think that the federally qualified community health centers saved millions of lives during COVID. They continue to be the place where we can see our children grow up and be healthy. And so it is an investment worth making. So thank each and every one of you for all that you do in that regard. And we're going to do everything we can to continue to lower costs. And if you're going to do a Latino tour, you have to go through the 8th Congressional District in Colorado.
Thank you. To inform our audience and the media here, which I will also give a shout out to our media covering this important conversation, I'm going to begin right here with our host, CEO, Executive Director of the agency here, and make our way around the table, ask you to please provide your name and who you work for and your role in that agency. Whitney?
Sure, thank you, Lily. Everyone, welcome to Kids First. My name is Whitney Gustin-Connor. I am the Executive Director of Kids First Healthcare, and I'm almost ready to celebrate my 5th year here.
I'm George Hartman. I'm the Pharmacy Services Director for Salute Family Health. Been here 23 years and love the work we do.
Hi everybody, I'm Padidar. I'm the family physician and also the Chief Medical Officer. I've been with Salute Family Health for 18 years, 17 years something.
Hi, my name is Dr. Amanda Jashinsky. I'm a pediatrician and the Medical Director at Kids First Healthcare. I've been at Kids First for 2.5 years and actually worked at Salute for 3 years before that, so working in Commerce City for some time now.
Hi, my name is Dr. Bob Mulch. I'm a retired family physician. I practice in rural Illinois in a rural health clinic. But I've lived in Colorado for 2 years, and I'm here representing AARP. I'm one of their volunteer advocates.
Hi, my name is Karen Moldavid, and I'm the Advocacy Director for AARP Colorado.
Hi, my name's Amelia Schachter, and I'm a retired oncology nurse, and I'm a advocacy volunteer with AARP.
I'm a member of AARP. Hi, I'm Ramona Martinez. I'm a former member of Denver City Council, and my district was one that probably had the most low-income families in the entire city. And I'm here today because I decided when I was on city council that if the public system was good enough for my constituents, it was good enough for me. So rather than use my private insurance, which we have, I used Denver Health, and the Westside Health Center was my primary, where I had my primary physician in the years that I was on city council. So I've been an advocate for public health for 30 years, and I'm still trying to get the attention of the U.S. government to let them know how badly we need you here in Colorado.
Thank you.
You know, I think it's certainly something that I saw as a healthcare provider. Luckily, we were in a private office, and so therefore we were able to assuage a lot of those fears, but in particular anything that is like a community health clinic, sometimes people are worried because of the fears that are stoked around immigration, and so it's incredibly important to talk to people about what the difference is, about what the history of the public charge is, how the administration and how healthcare providers are making sure that they get health care and making sure that they know that it's accessible to them no matter what their status is.
And I would only ask, because I agree with what Congressman Caraveo has just said, is that for us, the important thing is to reach out to communities and to families, to people they trust. So whether it's the congresswoman that they've gotten to know, or whether it's their doctor, or whether it's their clergy, we want them to know that the people that they trust are saying, go to that healthcare clinic, you'll get the care you need, you can trust. And that's what we want, is to use the people that families trust to be the access point for that care.
Thank you so much, Congresswoman.
See you, Jackie. Thank you. Hola, Jesús.
Jesús Sánchez con el Comercio de Colorado. Conversamos hace año y medio cuando faltaban horas para iniciar la línea de ayuda en salud mental. Pasado ese tiempo, ¿qué nos puede comentar sobre algunas cosas que se hayan logrado en materia de facilitar a las personas acceso a la salud mental?
Bueno, sin duda el apoyo de la congresista Caraveo en poder darnos los recursos que se necesitan para lanzar el 988, la línea que uno puede usar para comunicar cuando uno tiene retos en cuanto a la salud mental, es algo que ha ayudado y ha salvado vidas, y es algo importante, y por eso el presidente ha puesto tanto esfuerzo detrás del 988, porque cuando uno sabe que puede llamar 988 y tiene emergencia porque su salud mental necesita ayuda, uno no tiene que preocuparse del 911, puede marcar 988.
¿Hay algún aspecto relacionado con salud mental en el Distrito 8?
claro, lo vemos como en cualquier otro distrito, en particular en una comunidad latina donde no siempre se sienten a gusto hablando de los problemas de salud mental. Entonces estamos viendo no solo cómo seguir dándole los recursos a la línea para que sigan trabajando con la comunidad, también hablando de los problemas de salud mental para asegurarnos de que se están hablando en familia, en las familias latinas, y luego también enfocándonos en las necesidades de diferentes comunidades. Por ejemplo, yo tengo un bill que se va a enfocar en el 988, pero para los trabajadores agrícolas, porque tienen diferentes necesidades, diferentes recursos que son necesarios, y entonces nos estamos enfocando en la perfección básicamente de la línea.
Muchas gracias. Un momento para una foto.
Sí.
Gracias.
Muchas gracias, Jesús.
Go ahead.
You first. Okay.
Okay, yes, good afternoon.
Hello.
Chris
Good to see you.
Frescus with El Seminario Media. A question, someone here at the table mentioned about out-of-pocket costs, and we're well aware of that. Here's the dilemma with that, is with the out-of-pocket costs, now they have to figure out the deductible as well before they actually can afford to take a family member to the doctor or even have an operation. And this is the third part to that, is as we know, a lot of that is turning over to collections because the family's not able to afford that. There's an organization called Care Not Collect, which was established, I'm not sure how long ago, but what can you say to that?
So the work that Congress did recently to pass the No Surprises Act was very important, because the No Surprises Act was meant to keep patients, people who need care, from being blindsided by medical bills that they were not expecting. So to your point, when you walk into a doctor or a hospital, you want to have a sense of how much you're going to have to pay. Most of the time, if you have insurance, you can take a look at your insurance plan to see what it's going to cost you. Most of the time, you can talk to the doctor in the office or the staff of the doctor, find out what it's going to cost for the procedure you're getting. Oftentimes, there are additional bills that are not expected. Under the law today, no American should be facing bills that are totally unexpected. And if they do face them, they don't have to worry about paying them. The dispute on what is owed goes between the provider of the care, the doctor, the hospital, and the insurance company. And no longer will the patient have to be on the hook to pay those bills. That's one phenomenal law that Congress passed. The other thing we would tell people is be aware. Simply because you are not a medical professional doesn't mean you should not be aware of the cost you have to pay. When you go to buy a car, if you walk into a car dealership and you look at the sticker price of that vehicle and you decide to pay that, that's on you. If you didn't do your homework and look at the Consumer Reports or the Kelley Blue Book to figure out the price, then you'll probably be paying too much. So be an informed consumer of healthcare. You'll save yourself a lot of money, but then you'll have the law on your side if you get hit with a bill that you were not expecting.
May I add one more thing? Call centers. This has been a big deal with the hospitals, doctors. They're sending these people out there to receive the calls, which they're not trained. They do not know how to answer the questions properly, so there's a wall where now you have the patient needing to get some answers to do exactly what you had mentioned. And as you also pointed out, people sometimes, the illness becomes worse, and we've even heard stories where they passed on. Is there anything that your offices can do about that?
You know, I haven't looked precisely at the call center question, but I think what Congress is continuing to do is make sure that the laws we have in place are actually being followed and that we're continuing to look at transparency. So for example, Colorado and many states across the country and even at the federal level, we have passed laws around hospital transparency measures so that you can be that informed consumer and say, how much is my gallbladder removal going to cost from hospital to hospital? Well, hospitals have decided that they're just not going to comply with the law. And so we're trying to pass another bill at the congressional level to say, no, we're serious, you need to post these prices, because a minuscule number of hospitals are doing that across the country.
Great. Thank you both so much.
Thank you.
Congresswoman, Mr. Secretary.
Congresswoman, good to see you again.
Good to see you.
Secretary Kyle Clark, 9 News in Denver here. I'm going to clip a microphone on you.